Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the Public Health Weekly Update with data accurate through November 10th, 2022. Some of you will remember that about a month ago, I did a weekly update on nuclear war. And at the time, someone asked me why I didn't talk about dirty bombs. And at the time, it didn't seem relevant. Obviously, since then, there has been a lot of news about dirty bombs, and I thought it would be helpful to cover it just very briefly. Obviously, the reason is that several Russian military leaders have mentioned that they believe that Ukraine is going to use a dirty bomb in Ukraine as a false flag operation, as a way of making the Russians look bad. Recently, the UN Atomic Energy Agency concluded an investigation in Ukraine and found no evidence of a dirty bomb. But there's obviously concern that because it was raised by the Russians, they may in fact be intending to use one. So what exactly is a dirty bomb? Well, this is not a dirty bomb. And interestingly, this is not either. A dirty bomb is not an atomic bomb. A dirty bomb is any time explosives are mixed with a radioactive substance. So dynamite with cesium-137, for example, probably most accurately called a radiological dispersion device. The idea is that when the explosion happens, the blast carries radioactive dust, smoke, and other material into the surrounding area, into the lungs, the mouth, the wounds of those who are exposed, or contaminating the skin, hair, and clothing, and obviously contaminating the region as well. Important to understand when we will talk about a dirty bomb, it is not an atomic bomb with the massive amount of heat, blast, and radioactivity that's released. The main danger from a dirty bomb, according to most sources, is the explosion itself, which obviously, like as with any other explosion, can cause a significant injury and property damage. Most people think that the amount of radioactivity from a dirty bomb would not be enough to create a lot of acute radiation sickness from those exposed, except if they're very close. So the immediate effect would be from a low dose of radiation. The health effects would probably be relatively minimal, but it depends on a couple of things. Of course, the amount of radiation absorbed by the body, the type of radiation, the distance from the radiation to the individual when the explosion happens, the means of exposure, whether it's skin, whether you consume it or you breathe it in, and obviously the length of time exposed. In general, the closer you are and the longer you are there to a radiological event, the greater the risk to you will be. Now, interestingly, there have been no cases of dirty bombs actually being used, but it remains a very significant concern for people worried about public health and well-being, largely because of the wide availability of radioactive material. These materials are used in all sorts of settings: food, hospital, research facilities, industrial facilities, and so on. And unfortunately, they don't always stay where they're supposed to be. According to a white paper from the Nuclear Threat Initiative, the ingredients for a dirty bomb, the radioactive parts of it, are in tens of thousands of locations around the world. And the same report documented 325 instances in which nuclear or radiological material has been publicly reported to be stolen just in 2 years. And that's just public reporting. So as I say, there have been no evidence, no history of it, but it remains of significant concern because of the wide availability, the portability of a bomb like this. So you don't have to have an airplane to drop it or anything like that. It could actually be a relatively small volume in a car or a trunk or whatever. And obviously, it could have significant impact on a population-dense area. Obviously, more people close to the explosion, the more risk there would be. And it causes long-term impact, both psychological on people and geographic on the region. I would say, as others have pointed out, that a dirty bomb is only one type of RDD, radiological dispersion device, and others may appear to be more accessible and more impactful to those who wish to do harm. And I'm not going to go into any more detail than that. About 20 years ago, the Federation of American Scientists testified before Congress, and they had a hypothetical. If you have a small conventional bomb with cesium-137 set off near the National Gallery of Art on the mall in downtown Washington, D.C., there you can see it, it might only kill a few people, but it would create as much contamination as a Superfund site. And the area that would be impacted would cover 40 city blocks, including the Supreme Court, Library of Congress, and the Capitol. According to this report, those buildings might have to be abandoned for decades, and the decontamination of downtown Washington could take years and cost billions of dollars. Interestingly, it also estimated that there would be about 50 extra cancer deaths, so not nearly as much as we might think. However, that's not to say there's not a great impact, because the impact of a dirty bomb, like any other bomb, depends on a number of things. In this case, the amount and type of radiation, the size of the explosion, how much damage is done by the explosion itself, the density of the population, how many people are right there, is it enclosed, is it outside, wind direction, and so on. So a wind direction could move the plume any direction at all. So what advice do people have if you happen to be in the vicinity of a dirty bomb blast? First thing, stay away from any obvious plume or dust cloud. Don't touch anything thrown off by the explosion. Cover your mouth with anything you can, preferably a damp cloth, to avoid inhaling or ingesting any radioactive material that's in the air. Walk inside a building with closed doors and windows as quickly and safely as possible. Remove your clothing. This may get rid of as much as 90% of the radioactive dust, and place them if you can, in a plastic bag, because the clothing, it could be used later to determine how much your exposure was. Obviously, wash, shower, do whatever you can to make sure you clean up as much of your exposure as you can, especially protect your mouth. You don't want to eat, drink, or smoke. And if you're in a car, close the windows, turn off the air conditioner, heating, and vents, and so on. Avoid close contact to others until you and they are decontaminated, of course, unless they need first aid or whatever. Listen to the radio or your television or the building's loudspeaker for updates. I do want to say one thing. Other than seeing the explosion, you cannot tell, you cannot smell, you cannot see whether there's radiation. So at this point in our lives, if you're near a significant explosion, you probably should consider that it's likely to be a dirty bomb, even if it isn't, and act accordingly. So what is a dirty bomb? It's a device that is designed to cause damage by explosion and by spreading radiation. It's not an atomic bomb. It has never been used, but there's significant concern about its impact. A great deal more information about the college, about public health issues on the College of Public Health website. Please feel free to share this video with anyone who might be interested. As always, I'd like to thank Dara Young for editing, producing, adding captions, and posting this video. And finally, if you have any questions about this or any other public health issue, let me know. As you can see, I often do my weekly updates based on questions that come in from the audience. So until next week, please be well.